If someone has ever told you that knee osteoarthritis has no solution, that it's just wear and tear, that it's age, that you have to learn to live with it, I understand why you believed it. After all, it came from a doctor, it came from a test, it came from an image with a complicated name. But let me tell you what I see in the clinic every single week. People who arrive convinced there was no way out, that they had already given up on walking without pain, on getting up from a chair without holding on to something, on going down the stairs without thinking twice. And within just a few days of the right exercise, not a lot of exercise, not generic exercise, but the right exercise, they started to feel a difference they didn't expect to feel anymore. The osteoarthritis is still there. That doesn't change. But the pain, the limitation, that's another story. And it's exactly that other story this video is about. Today I'm going to show you just 3 exercises. Not 10, not 20, 3. Each one chosen for a very specific clinical reason. And together, they do something that long lists of exercises rarely achieve. They tackle the problem for real in a simple way. No gym required, right from your chair. I've been a physical therapist for over 10 years, and these are the exercises I prescribe the most for knee osteoarthritis after 60. And stick around until the end because in the bonus, I'm going to show you the most important functional exercise for the knee and 2 stretches that most people never associate with osteoarthritis pain, but that make a huge difference. Let me explain why osteoarthritis hurts and why exercise is the most powerful answer there is for this problem. For years, medicine treated osteoarthritis as something simple. Wear and tear, like an old tire that got worn down with use. And if it's wear and tear, the logic seems obvious. Rest, avoid strain, accept it. But science has changed, and it has changed a lot. Today we know that osteoarthritis isn't just wear and tear. It's a process that responds directly to what you do with your body. And exercise acts on this process in 3 ways at the same time. It strengthens the muscles around the knee, which start to absorb the impact the joint can no longer handle on its own. It improves range of motion, keeping the knee functional, and it stimulates the production of synovial fluid, the joint's natural lubricant, which is only produced when the knee moves. Think of it this way. When the knee stays still for too long, this fluid thickens and the joint becomes stiff and painful. When it moves, the fluid flows and the pain decreases. Movement is lubrication. There's a data point I really like to share with my patients. A 2021 study showed that strengthening the quadriceps can improve knee pain and mobility in just 6 weeks, not months, weeks. And that's exactly the muscle we're going to work in the first exercise. And for those who are still wondering whether it's safe to exercise with pain, the answer is yes. Mild discomfort during exercise is normal and expected. What shouldn't happen is sharp pain inside the knee. If that happens, reduce the range of motion and keep going. Let me know in the comments. How old are you and where are you watching from? I love seeing how far our content is reaching. I reply to everyone with a lot of care. Now let's get to what matters. Exercise 3. Let's start with the most important muscle for anyone with knee osteoarthritis, the quadriceps. It's located at the front of the thigh and is mainly responsible for protecting the joint during everyday movements. When it's strong, it absorbs the impact that the knee can no longer handle on its own. When it's weak, and after 60 it progressively weakens, the knee is left exposed. To do this exercise, sit properly on a chair with your back straight and your feet flat on the floor. Now slowly extend one leg. Straighten your knee as far as you can without pain. When your leg is extended, gently pull your toes toward you and tighten your quadriceps. Place your hand on the front of your thigh and feel the muscle engage. Hold for 5 seconds. Then lower your leg back down to the floor with control. Don't just drop your foot. Bring it down with intention. Do all the repetitions on one side, then switch to the other. I need you to pay attention to 2 things. The first is doing the movement too fast. When that happens, the muscle doesn't have enough time to fully activate. Go slowly, as if your leg were moving through water. The second is forgetting to squeeze the quadriceps at the top. That contraction is exactly where the exercise really works. If you want to progress, add a light weight to your ankle. 1 or 2 kilos already make a difference. Do 2 sets of 10 repetitions on each leg with 30 seconds of rest between them. Now let's move on to the next one, which works something most people never associate with knee stability. Exercise 2, pillow squeeze. Grab a pillow. Even one from your couch will do. This exercise targets the inner thigh muscles, the adductors, and they have a direct connection to knee stability that most people never imagine. Let me explain why. When the adductors are weak, the knee tends to collapse inward during any movement, walking, going up or down stairs, getting up from a chair. This misalignment increases pressure inside the joint unevenly, exactly where the osteoarthritis is already present. Strengthening these muscles is a way to protect the knee from the inside. To do it, sit with your back straight, feet flat on the floor at hip width. Place the pillow between your knees, centered, not too far forward or backward. Now squeeze the pillow with both knees at the same time, as if you were trying to flatten it. Squeeze firmly, hold for 5 seconds, and release slowly. It's not a quick movement. It's a sustained contraction. If you place your hand on your inner thigh, you'll feel the muscle engage when you're doing it right. I need you to watch out for something I see all the time, squeezing only with the knees without engaging the inner thigh. When that happens, the exercise loses its effect. Think about initiating the movement from the inside out. The contraction starts in the thigh, not the knee. And keep your back straight throughout. Don't lean your torso forward to compensate. Do 2 sets of 12 repetitions, holding for 5 seconds each, with 30 seconds of rest between them. Now let's move on to number 1. This one gets me the most excited because it works something the other 2 can't do on their own. Exercise 1. This is the one that completes the knee protection cycle. In the previous exercises, we worked the quadriceps and the adductors, muscles that act on the front and inner side of the knee. But there's a muscle on the side of the hip that's just as important and almost never gets attention, the gluteus medius. When it's weak, the hip drops to the side with every step, the knee becomes misaligned, and the pressure inside the joint increases. Strengthening this muscle while seated, using a resistance band, is a safe and highly effective way to fill that gap. To do it, place the resistance band just above your knees. Sit with your back straight, feet flat on the floor at hip width. Now slowly push your knees outward. Press against the band, as if you were trying to separate your knees from each other. Go only as far as you can without leaning your torso. Hold for 2 seconds at the widest point, feeling the side of your hip working, then bring your knees back together with control. Don't let the band snap them back. The return should be just as controlled as the movement out. I need you to pay attention to 2 things. The first is leaning your torso to the side when opening your knees. When that happens, it's your body compensating for what the gluteus medius isn't able to do. Reduce the range and focus on the right muscle. The second is releasing too quickly on the way back. That's exactly where half of the work happens. If you don't have a resistance band at home, you can start without it. Just open your knees against the resistance of your own hands. But it's definitely worth getting one. They're inexpensive and completely transform the exercise. It's a good idea to start with 2 sets of 15 repetitions, with 30 seconds of rest between them, and you can progress to 3 sets as it starts to feel easier. Now be honest with me in the comments. Did you find it hard to fit these exercises into your routine? I promise you, it's worth it. The 3 exercises we did today are the foundation. But in the end, what really matters isn't what you do here. It's what you're able to do out there. Getting up from a chair without thinking about your knee. Climbing stairs without gripping the handrail for dear life. Living without every movement feeling like a negotiation with pain. But if you want to go further, and I hope you do, today's bonus has 3 things that will complete this routine in a way you'll actually feel in real life. When you're ready, and after you've been doing the 3 exercises for a few days, start the sit to stand. Because this is a movement you already do dozens of times a day without even noticing. And when it hurts, life itself starts to shrink. Sit on the edge of a chair, feet flat on the floor at hip width, arms crossed over your chest. Gently engage your core, lean your torso slightly forward, spine aligned, not rounded, and push through both feet to stand up. Once you're standing, stay steady for a second. Now the most important part. Lower yourself back down, counting 4 seconds. Slowly, with full control. Landing on the chair, not dropping into it. If this movement still feels too demanding, place a pillow on the chair before sitting. This makes the chair higher, reduces the range of motion, and takes some of the load off the knee, making the exercise much more accessible. Gradually remove the pillow as your knee gets stronger. And when the standard version feels comfortable, try the progression. Stand up with both feet and sit down using only one leg. That single leg descent is where the quadriceps and glutes truly work together. And that's exactly the control that will make a difference on stairs and in daily life. Start with 2 sets of 10 repetitions. Another extremely important addition is stretching. Sometimes knee pain doesn't come only from muscle weakness. It comes from tightness. A shortened muscle pulls the joint out of alignment, increases pressure on specific areas of the cartilage, and keeps the pain alive even when you're already stronger. Stretching is just as much a part of treatment as strengthening. The first is the hamstring stretch, the muscles at the back of the thigh. Sit on the edge of a chair and extend one leg forward, heel on the floor, toes pointing up. With your back straight, lean your torso slightly forward. The movement comes from the hips, not the lower back. Go only until you feel a gentle stretch in the back of your thigh. Hold for 30 seconds, breathe calmly, and switch sides. The second is the iliotibial band stretch, a strip of tissue that runs along the side of the leg from the hip to just below the knee. When it's tight, it pulls the knee out of alignment and contributes to pain in a way most people never realize. To stretch it, sit comfortably on a chair and cross one leg over the other, ankle over the opposite knee. With your back straight, gently press the crossed knee downward with your hand. Don't force it, just light pressure. Hold for 30 seconds, feeling the stretch on the side of your hip, then switch sides. 2 simple stretches, done without leaving your chair, that give your knee much more freedom of movement. Do them every day, even on the days you don't do the main exercises. I want to leave you with one thought. Osteoarthritis is not a life sentence. It's a condition that responds, and responds a lot, to what you do with your body every single day. The 3 exercises we did today won't erase the wear and tear you see on an X-ray, but they can completely change how your knee feels in real life. And that difference between the scan and real life is exactly where quality of life lives. That said, every body is unique. If your pain is very intense, if your knee is inflamed, or if something has recently gotten worse, consult a doctor to understand what's going on, and a physical therapist to build a plan tailored to you, not a generic one. This video is educational and designed to reach as many people as possible. But you deserve individualized care. Tell me in the comments, before this video, did you think osteoarthritis had no solution? Or did you already know exercise could make a difference? I want to know what changed for you today. I left 2 options in the pinned comment that can help speed up this process. The first is a complete exercise program, organized step by step for you to follow at home at your own pace. The second is a natural supplement developed specifically for joint health. The links are there. If this video reached you at the right moment, share it with someone who also needs to hear that osteoarthritis has a way out. And subscribe to the channel so we can keep this conversation going. In the next video, I'll talk about something very few people connect to pain: lack of mobility. Don't miss it. See you there.